Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
5-HT427. 5-HT427 are GS type of receptors which increases the cyclic AMP, or they can also decrease the cyclic AMP also. So these are mainly present in brain and central nervous system. Here these will cause increased intestinal secretions. They will increase the intestinal secretions, and also they will increase the peristalsis. So it is important for the peristalsis and intestinal secretions. We have a drug called as renzapride, which is a selective 5-HT4 agonist.
thank you and thank you for watching.